Hello, I'm back. So we're going to talk about viral diseases of the skin. But before we continue, I just wanted to make sure I point this to you. So we have this document that I created that can be supported by another table that we also have posted in iCollege. And I want you guys just to use this for your study. You don't have to turn it in. You're just going to use this to help you summarize the characteristic, the transmission, the signs and symptoms, the pathophysiology, and if there is a vaccine or any other important information about the diseases that we're covering in these chapters. Okay, chapter 19, which includes AIDS, and then chapter 21, which includes skin, and then all the way through chapter 26. Okay, so we're all the infectious diseases. So make sure you make good use of this table and you have this as your study guide and as your cheat sheet during the exams. Okay, so going back to where we were. We're going to talk about diseases that are transmitted by contact, for example, warts, herpes simplex, hand, mouth, and foot, and diseases that are transmitted by the respiratory route, even though they show a symptom in the skin, which are smallpox, chickenpox, measles, rubella, fifth disease, and rosella. Okay, so most of the viral diseases from the skin are actually not skin diseases. They're systemic diseases that start through the respiratory system. That's how they're transmitted, and they show a rash on the skin that is significant and important for the diagnosis of those diseases. Okay, they're usually problematic and more serious in children and developing fetuses, where the immune system is still not fully developed and these diseases are easy to be transmitted. So we're going to start with warts. The CDC says that the HPV is the most common sexually transmitted infection. Also, some types of, so this disease is caused by papilloma viruses, right? And they make these little skin growths that are 50 types or more than that of papilloma viruses that can cause warts, okay? One problem is that, one complication is that they can be cause of skin and cervical cancers, okay? About 14 million people become newly infected each year with papilloma virus. And it's so common that almost every person who is sexually active with the HPV can get HPV at some time in their lives, and if they don't get the HPV vaccine. So the HPV vaccine is important as prevention for men and women between 10 and 25 years old. That's when they're usually given. Another cancer that can be caused also is oropharyngeal cancer. So treatment of these warts is usually with cryotherapy, electrodesiccation, or salicylic acid. Smallpox. Smallpox, respiratory transmission, right? It moves into the bloodstream and then it can infect the skin. Look at this. These vesicles, they fuse together, making this really ugly type of rash, okay? This is the only disease, this is the only infectious disease that was eradicated from the world. It's the only one, okay? And there are a few laboratories that have the smallpox in storage in case of a bioterrorist attack or something that, you know, spread the virus again into the population. Remember that this is the virus where they started at first developing vaccines. So vaccines were developed to treat smallpox, but they were actually done with the cowpox virus. Because the viruses were so similar, it was important in acquiring and in promoting immune protection in those people that received the vaccine. Okay, the way they found out that that was possible is they were giving these the debris from these rashes for kids to breathe, and that was making those healthy kids protected and not get smallpox in the future. So they said, when we start to give little parts of the bugs to healthy individuals, that shows like to be an effective way to prevent diseases, and that's how vaccines started. Okay, it took a long time until the smallpox got to be eradicated, but it's super important to notice that it's possible, and it was made by a vaccine. Chickenpox, also called varicella. Chickenpox is caused by the herpes virus, varicella zoster. So it's called human herpes virus 3. You're going to see other HV viruses that we're going to talk about, okay? So this one is the one that causes chickenpox, transmitted by respiratory route, and the vesicles are fluid-filled, but the fluid can become pus, okay? There are complications that can cause brain dysfunction, but that's rare. The virus, usually after chickenpox is over in the childhood, can migrate to the central nerve ganglia. Remember where that is? The ganglia that is very close to the spinal cord. And that virus can become latent there. So they can being incorporated into the host genome. So that little DNA from the virus becomes a provirus, sits latent in that nerve until one day, let's see the next slide. One day, you see, so that's the spinal cord, and then you have what's the name? The sensory nerve ganglion, and that's where usually the virus is latent, inside the cell body of these neurons. So they are latent because they incorporate into the chromosome. One day, the immune system of an elderly person is not working as well anymore, and the suppression mechanism for that virus to multiply is somehow withdrawn, and the virus starts multiplying. And that multiplication will lead to a secondary disease that is called shingles. Okay, so first you have chickenpox, and then the virus becomes latent, and after many years of chickenpox being resolved, you can have shingles. The shingles, as being a reactivation of the latent varicella zoster, happens because that virus goes from the ganglion all the way to the peripheral nerves, right? And remember, that's going to be going in the opposite direction of the sensitive information. Sensitive information goes from the tissue to the spinal cord, to the central nervous system. And the virus is migrating the other way, through the nerves, through the axons, right? And then it promotes a rash that looks like this. One of the things that is important in diagnosing shingles is that it's usually going to be unilateral. You're not going to have this in both sides of the body. Okay? People 60 years of age or older should get shingles vaccine. So the shingles vaccine, the main one is called Zostavax, is different from the chickenpox vaccine. Okay? So they should get the vaccine whether or not they recall having had chickenpox. This vaccine is 19 times stronger than the chickenpox vaccine. And the shingles vaccine protects against the varicella virus that will lead to chickenpox in adult who would never been exposed. So for example, even if you didn't have chickenpox, you should still get that, because the vaccine protects people that had chickenpox or people that didn't have and can acquire the virus and develop shingles. Okay? Another information that sometimes students ask me in class is, if you had shingles, do you still need to take the vaccine? Yes, you do. Anytime after the end of the course of shingles as a disease, you can receive the shingles vaccine, but you cannot have it during the course of the disease. Herpes simplex, it is what we call cold sores or fever blisters, right? Many of the individuals are asymptomatic carriers, and the only way to spread this disease is by direct contact. 90% of the population is infected with HSV1 or 2. You have 1, which is the main one, but you can also have 2. 2 is spread mostly sexually, but can also be transmitted by oral route, and vice versa. The HSV1 can also be transmitted sexually, okay, even though it's primarily spread by oral and respiratory route. This is not what is called canker sore. That's a different type of disease, usually caused by the Neisseria gonorrhea. So here we're only talking about cold sores, those blisters that look like this one in the picture. One important feature of herpes simplex is that it can be a latent disease, and it's usually that. So the way the disease becomes latent is this DNA virus makes a provirus in the trigeminal nerve ganglia and in other ganglia, like in ganglia close to the sacral nerves. You can also have mostly HSV2 in that case. And by seeding that, one day the virus can become reactivated, start multiplying again, migrate through the axons of these neurons, and provoke a lesion in the edge, in the extremities, right, of these axons, which are innervating the skin. And then you see that sore that comes and goes because of this reactivation. Measles. Measles is another viral disease transmitted by respiratory route, and it has very typical macular rash that looks red like this. So remember, macular, there's no liquid inside this type of rash, okay? But there is what is called Koplik spots, which are this. They're like whitish areas, usually in the oral mucosa, and they're very important in the diagnosis. 1 in 1,000 cases can result in encephalitis caused by measles, okay? It is prevented by the MMR vaccine or measles, mumps, rubella vaccine. Children under 1 year old cannot receive this vaccine because they still don't have the immune system ready to receive an attenuated virus. High fever, cough, runny nose, and red watery eyes like conjunctivitis are common symptoms. Up to 9 out of 10 susceptible persons with close contact to a measles patient will develop measles. The virus can be transmitted by those infectious droplets, but also airborne. They can be spread by dust, the same way as chickenpox. That's why bigger distances than 1 meter between the two people are still transmissible. You don't need to be so close to the person to get measles or chickenpox because it's highly contagious. It can remain infectious in these dust particles in the air for up to 2 hours after an infected person leaves the area. So that's pretty contagious, right? This is an RNA virus, just to make the difference from the other ones that we were talking about. 1 to 3 out of 1,000 children who become infected with measles can develop the complications. One of the most common complications is subacute sclerosis panencephalitis, but it's rare, okay? And this disease is degenerative, and it makes the nervous system degenerate in a way that causes behavior and intellectual changes in the patient, as well as seizures that usually develop in kids between 7 and 10 years old after the measles infection. Rubella is another disease that is also called German measles, It's caused by the rubella virus. It's another type of macular rash. I don't expect you to be able to distinguish between the rubella and the measles rash because they're pretty similar. Just remember, Koplik spots are typical of measles and not of rubella. Important here is that it's transmitted by respiratory route and very dangerous to pregnant women because of the congenital syndrome. So fetus can have damage, can cause deafness, heart defects, mental retardation in 35% of the cases, and 15% mortality within the first year of life of that child that was affected during pregnancy. MMR vaccine, also used to prevent this disease, should be given prior to pregnancy, not during pregnancy. Other viral rashes, like Fifth disease, is also transmitted by respiratory route. It has a macular type of rash. Rosella also has some type of macular rash. And hand, foot, and mouth are caused by enteroviruses. And this is usually spread by contact. That's the type of rash that shows. This is very common, transmitted in healthcare facilities because the kids are always touching each other and touching the mouth, touching the feet, and that is very easily to transmit. It causes fever. It usually can infect the throat, cause the same rash in the throat, and if that happens in adults, it can be pretty painful, but it's a lot more rare than in children. I have a little case here, so if you want to pause your video and try to figure out what type of disease this could be, you may not get to only one type of disease. It could be more than one. So maybe all the diseases that affect children, can cause fever, and have a macular rash could be potential causative agents of this disease. And you can look at these tables where I'm just putting a square around the microbes that we are talking more about, okay? And then another case here where you have vesicular and pustular rashes, and it explains how it's a kid being affected in elementary school, and what causes could be for this type of skin rash, right? That is contagious. And then here are diseases that could be the possibilities. Okay guys, next video we're going to talk about fungal disease and eye diseases. I will see you soon.